Welcome back to our show today again. We have a very special guest, a Congresswoman, Zoe Lofgren. She represents the 16th District in California. And thank you again for being here with us today.
Thank you.
In the first part, we already talking about one of the main issues that going on right now is the housing market.
Right.
Now, the second issue we're concerned about the health care.
Right.
And lately, do you have any proposal letter to the
Well, we
president?
have, as you know, we passed health care reform in the last Congress. It's being implemented over a period of years, and so people haven't seen the full benefit of it yet. However, some of the value is already being seen. For example, one of the requirements of the Act is that insurance companies have to let parents keep their adult children on their insurance plans until age 26. It's very important because as so many parents can tell you, I could tell you as well, young adults, when they have jobs that don't have health care insurance oftentimes. Or you know, they're out of school, but it's very hard for recent college graduates to get a job right now. And so the ability to keep them on your insurance is really, really important. That has already gone into effect. Pre-existing conditions, it prohibits denial of care because you have what's called a pre-existing condition. We had a list of what was considered pre-existing conditions, and I'll tell you, any adult who's reached age 40 has a pre-existing condition. It was basically an excuse to not cover people, and that is no longer permitted. And finally, in the general insurance reform area, we would see this phenomena where you would pay and pay and pay, and then you have a serious illness, and they would look at a way to deny coverage, sometimes based on undisclosed so-called pre-existing condition. That is no longer permitted. What we would see, I mean, just heartbreaking cases of people who had paid into their insurance for 30 years, now they have cancer and they're cut off and they won't pay for them. So you can't do that anymore. For Medicare, we have made some positive changes so that senior citizens who have medication needs, it used to be there's something called the donut hole where you pay and pay, but there's a period of months, so even though you're paying, you're not covered, you don't get your medication. So that period of non-coverage is going to be reduced to nothing, so you're covered year-round, but it's going year by year, so we've shrunk that uncovered period. We've also done something I think is very important, which is preventive care cannot have a copay. We don't want any deterrent to going in and getting preventive care, because prevention saves money in addition to saving lives. So that are some important things that we've done. Now recently, the California delegation, again the Democrats, were in touch with the president about the Medicaid program in California. We know that with the poor economy, we've got more people on the Medicaid program called Medi-Cal here than ever before. And it's very important that services not be further diminished. There was a proposal to limit Medi-Cal patients to no more than 7 doctor's visits a year. Well, how would that work? If you've got, you know, diabetes, I mean, that's impossible to have a healthy person with that kind of limitation. There are a number of other proposals, and we outlined very strongly to the president our opposition to them. Just this week, as my plane was landing, I discovered that some of the state's requests in terms of reductions were approved, but not all of them. And I hope that our voices had some role to play in that.
Wow. Talking about the healthcare reform, I heard that they will, you know, all the people in the U.S. have to have healthcare.
That's correct.
Like coverage, but they're not taking effectiveness until 2014.
No, the the coverage requirement will be coterminous with the coverage.
Oh, okay.
There's a lot of misinformation being put out around that, and but ultimately, and a lot of it's directed, frankly, to young people who feel invulnerable. And if you see, you know, you're 22 and you feel strong and young and nothing can happen to you, but if you're in a serious auto accident, you're going to be in the hospital, and who pays? You and I pay.
Yes.
So there needs to be some coverage so that people can have responsibility and they don't end up loading their costs onto their neighbor.
Is that bill complicated? Because, like, to me, I'm not understand well.
Yeah.
So.
Well, it's passed already, and the reason, I think part of it is there's been a lot of misinformation distributed for political reasons. And also because it takes a while to gear up, you know, people don't see all the results. I mean, when Medicare was passed the first time, it was 1965. And it took, you know, half a decade to completely implement. It's a huge program. The same thing as this. It's going to take almost 5 years to fully implement it. But I think the parts that have been implemented so far, we've had very positive responses on. And I think that overall, well, the budget office says we will save money, and the experts say that we'll have better coverage.
Oh, I see.
I see. Yes. Now for the education.
Yes.
Yes. I understand. We know that you were Evergreen Valley College on October 17th.
That was a lot of fun.
Oh, really? How was that?
Well, I thought I was coming over to speak to one class, and when I got there, it turned out a lot of students wanted to see me, so it was in the auditorium with many, many classes. But I spoke just a little bit about some of the issues that I thought they would be of interested in. And then I took questions and answers from the students, and they were smart and they were terrific. So it was really a lot of fun for me.
So do you have any plan for the education?
Well, there's nothing more important really to the future of the country than education.
Yes. A lot of big cuts right now, so.
The cuts are primarily from the state of California, which has huge budget problems. And I actually have a lot of sympathy for what our governor is trying to do, because he inherited, just as President Obama did, he inherited a mess, and he's trying to fix it. So there have been cuts, however, to K-12 education as well as to higher education. And there may be more cuts depending on what happens with the revenue in January. What we've tried to do in the House, at least the House Democrats, is to make up for those cuts, at least till we're out of this economic decline. Last Congress, we passed something called the American Recovery Act. And what it did was it provided enough funds for states to avoid layoffs and cutbacks in K-12 education, and also enough funds to just for higher ed just to stay even. However, the Senate would not agree to a second year of that. And so after the second year, that's when the cuts came. And now the new Republican majority is opposed to anything of that nature. So I worry a lot about what's happening in California, but what we're trying to do is at least our part. It's not, the federal government doesn't fund most education, but we play a crucial role in education in disadvantaged areas. So we have parts of San Jose where there are children who are eligible for free and reduced lunch. We pay extra money in those schools, which include a lot of the schools in the 16th district, so that we can have enough education for those young people. And then the other important role we play is in higher education, in our student loan programs and in Pell Grants. And we've made some big progress there.
Oh, that's great.
On the student loan program, we took action when the Democrats were still in majority to cut the interest rates in half, which over time will save families a lot of money. Also to consolidate in the federal direct student loan program so that the savings from the bank loans could be funneled into more federally insured student loans. The other thing that we've done is to expand the Pell Grants, which are for middle class and less affluent students, that just pays their tuition, to to increase the eligibility and also to increase the actual grant so that more young people can go to college. Because you think about the wonderful valley that we have here, but if it weren't for education, where would we be? We would not be anywhere.
Exactly, yes.
Now let's talk a little bit about politics, just a little bit. I know that in the past you've been working well with the Vietnamese community, and you're so helpful to our community and speak up and then passing on the bills, go to the Vietnam, here I was. And then what do you think about in back home in Vietnam right now? All the people try to speak up the voice to a democracy, and they've been arrested.
It's awful.
What can you do as a congresswoman that we can?
I'm one of the co-founders of the Vietnam Human Rights Caucus in the House of Representatives. It's a bipartisan group. Congresswoman Loretta Sanchez and I were the co-founders on the Democratic side, and Congressman Chris Smith and Ed Royce on the Republican side. And we have worked, even though we don't agree on many other things, we work together on this to try and advocate successfully for human rights in Vietnam. On a global level, we found that when Vietnam was taken off the list of countries of particular concern, their behavior deteriorated considerably. And so we have advocated for and written to Secretary Clinton asking that Vietnam be placed back on the list of countries of concern because of their oppression, especially of religious individuals. Also, though, advocates of a free press and from human rights generally are being oppressed, they're being arrested. People who are utilizing the internet, there are efforts being made to prevent that from happening. And so we have legislation that we're supporting to oppose that. Another thing that we're doing, but quietly, is to try and make connections between wily engineers in Silicon Valley and internet users in Vietnam, because sometimes there's ways to defeat these technologically these efforts to suppress internet communication, and we're eager for that data to get into Vietnam. I think that if over time there will be freedom in Vietnam, but we have a role to play here in the United States. Obviously, it's very important that Americans of Vietnamese descent be the leaders in this advocacy, and they are across the United States and especially here in our valley. But we can press the Vietnamese government. They are eager to have a productive relationship with the United States, and I think if we use our leverage, we can extort some improvements from them, and if we never give up that effort, I think we will help see some improvements there.
Any plan for the future about Vietnamese on CPC list?
Well, we have not succeeded in getting Vietnam back on the list. We have a bill to do it, we have a letter to do it. But one of the things, these are long-term efforts, and we have the Commission on Religious Freedom, the U.S. Commission, that we work with on a regular basis. They send people into Vietnam so they can actually document what is going on. Part of it is an educational effort, not just with Secretary Clinton, but also in the legislature itself. I meet with Secretary Clinton personally once a year when we have our refugee consultation, and every year I raise this issue with her. But I'll give you an example. Senator Barbara Boxer is someone who I think is a very good senator, but this was not something that she had spent her capital, her political capital on, and yet when she found out what was going on, she became actually a leader on this issue in the United States Senate. She is on the bill, she's very active, and she feels it in her heart. So that is a great improvement. We're making strides forward. So part of it is those of us who know need to speak to our colleagues, because I think when we passed the Human Rights in Vietnam bill in the House, it was nearly unanimous. It did get stuck in the Senate. I think that we don't know because it was secret holds, but we think it was one Democrat and one Republican that held it up. And but we're not going to take that. We're not going to take that.
Yes. Well, actually, you've been having work, you know, working with the Vietnamese community. What do you think about the expansion of our community, and what can we do as a role of the Vietnamese to help you or to support you so then you can raise the voice for us in the Congress?
Well, I'll say this. One of the enduring honors that I have as an elected official is representing so much of the Vietnamese community. When Saigon fell, I was actually working for my predecessor in office, and as you're too young to remember, but the American ambassador at the time was requiring original documents in order to get people out. It was ridiculous. And I was on the phone arguing with the embassy when the phone went dead. And people escaped, and then later people, you know, we had people, relatives of Americans who fled through the jungle, people on boats. I remember I volunteered with the Red Cross to welcome people here. Ever since that time, the Vietnamese who we are lucky came to San Jose have played a very important role in our community, both in our business community, in our civic community, education, religious, everything. And so as the community matures, I continue to feel honored to support them. I know that when I advocate to the government, whether it's President Bush or President Obama, that the community is behind that effort. And so I have no complaints and only praise for the Vietnamese community.
Yes. And thank you very much again for your time.
Thank you.
And due to your busy schedule as a Congresswoman. And in the closing statement, if you have any words to the viewers, please do so.
Well, I'll just say this. Being your representative is important to me, and I want to do my very best to represent you. And whether it is a bill that you think I should vote yes or no on, or whether it's some assistance that you might need with your family, I want to hear from you. So you can either write or email or call me. It's really a treat for me to hear from you, your viewpoint. If I can help you, I want to do that. This is something that every day I think about, and every week when I fly back to DC, I'm thinking about the people I met while I was home and the hopes that they have for their own future, and how I might do something to help their future become more real. So that would be my plea. With thanks for having me on.
Thank you so much. And last but not least, and your office have Vietnamese people as well?
Yes, yes, we do. We have people who speak in Spanish, Vietnamese, and Cantonese.
So feel free to contact your office.
You bet.
And again, the phone number, if I remember, it's right, 408-271-8700. Okay.
Very good.
I will remember that numbers, and hopefully our viewers will be having that number in handy in case that if you have any concern, any issue, you can call the office and search and help. And again, we're very honored to be here on behalf of NetView staff and our viewers. So thank you very much.
Thank you.
Good luck.
Thank you so very much.
Good, we need it.
Thank you so much.
Bye-bye.